Much. I'm going to introduce our next speaker. I have so many questions you all won't get to ask any when this is over. Next, I'd like to introduce Sara Hammerschmidt, who will provide her perspective from the private sector. Sara works to help designers, planners, and builders understand that they have a responsibility to shape our buildings and cities in ways that give people the opportunity to make the healthy choice, the easy choice. So please welcome Sara.
Thank you. Thanks, Shriki. And thank you to the Roundtable for having me today. I am going to speak for a little bit on the role of real estate developers and other private sector land use professionals in promoting and achieving health equity. So I know you have received some background information as part of the agenda on ULI and the Building Healthy Places initiative that I work on, but I just want to ground my remarks really quickly. So the Urban Land Institute is an 80-year-old nonprofit dedicated to promoting best practices in real estate development. And we use convenings and research and case studies and other strategies to help our 40,000 or so members who are professionals from the real estate and land use industries to achieve our mission, which is to help create and sustain thriving communities worldwide. And I think the mission is a powerful reminder of the responsibility and the opportunity that our members have as shapers of the built environment to create places that are good for all people and to foster cities and neighborhoods that can help people live their best life possible. So about 4 years ago, in July of 2013, ULI launched the Building Healthy Places initiative to engage our membership and our networks in shaping places and projects in ways that promote health. It was launched out of a recognition that many global health trends are pointing in the wrong direction, as we all know. We recognized that the real estate community needed to do more to be part of the solution to our global health problems. And our theory of change is that we advance the ULI mission and we promote healthy, thriving communities by engaging and informing and inspiring our members and our partners. And we believe that our members and all land use professionals can promote health in 3 different ways. So through leadership in their own organizations by promoting things like workplace wellness policies or having headquarter buildings that have accessible staircases or access to daylight, through their investment in project decisions in their own business, and also through their influence in their communities by supporting decisions that, for example, increase opportunities for people to be active or enhance their access to healthy food. So through these 3 ways, we are working with our members to improve health. And when we talk about health at ULI, we talk about creating healthy places for all, recognizing that where you live and the environment in which you live have a big impact on health and create health disparities. So the private sector, including real estate developers, designers, investors, and the like, has a responsibility for creating healthy places that don't exacerbate inequitable conditions. And I will give some examples of that some of our members have worked on in a little bit. But first, when engaging with professionals from the private sector, and really from any other discipline, we've learned that it's important to understand perspectives and terminology. So I just want to take the term equity, for example, which is what we're really talking about on this panel. And I just looked it up in the dictionary the other day, and it gives us 2 very different definitions. So I think when the group in this room talks about equity, we typically mean more along the lines of the first definition. So to borrow from PolicyLink, equity means just and fair inclusion. An equitable society is one in which all can participate and prosper with the goal of creating conditions that allow us all to reach our full potential. In contrast, equity to a real estate developer is more along the lines of the second definition that relates more to value and worth. So equity in real estate relates to the component of development capital provided by investors who obtain the return mainly from project performance. Those are very different definitions and very different meanings of the same word. So to help overcome some of these barriers, something that we have been encouraging our members to do is reach out and form new partnerships between real estate developers, designers, architects, planners, engineers, public health professionals, as we know it's going to take a coordinated effort to improve our built environments in ways that improve health for all. And at the same time, we emphasize the importance of learning different perspectives and definitions from other disciplines. About a year ago, we, as ULI staff, started partnering with staff from other built environment-focused membership organizations, including the American Institute of Architects, the American Public Health Association, and the American Planning Association, in an effort to understand how our work can be best leveraged to reach our collective memberships. We created the Joint Call to Action to Promote Healthy Communities. And with this document, we are encouraging our combined 450,000 individual members who all work in built environment-related professions to embrace collaboration across their professions to promote healthier and more equitable communities. We believe that when professionals in the fields of the built environment and public health work together, we can multiply our potential to improve health for everyone. So as staff, we are working together to define an action plan and specific strategies that our organizations and our members can use in this effort. But the joint call to action really calls on our members to build relationships, establish health goals within their projects and plans, implement strategies and certification systems that improve health, and share their expertise and communicate about the importance of health. A project that we launched at ULI in 2014 that is requiring these types of new partnerships in an effort to create more healthy and more equitable places is our Healthy Corridors project. So Leslie actually showed a great picture earlier of an unhealthy automobile-centric commercial corridor. They exist in nearly all communities. They make it challenging not only to walk and bike, but also to access healthy foods, access transit, jobs, and other services. These corridors often cut through low-income neighborhoods, and they separate residents from each other and from the possibility of easily and safely accessing the jobs and the services they need for their everyday lives. There's been a lot of work done on revitalizing these kinds of corridors, from making the environments safer and more aesthetically pleasing, bringing in a complete streets approach with sidewalks and bike lanes and crosswalks. ULI's done a lot of prior work on corridors, actually, through technical assistance programs and projects with our Rose Center for Public Leadership. But we realized a few years ago that there's been less attention to the health issues that arise for those people who live, work, and travel along the corridors. Less attention to the needs of the people who live in the neighborhoods adjacent to these corridors, who are so often low income, and who in theory rely on the corridors, the corridor services during their daily activities, or they could rely on these services if they actually existed, because in a lot of these cases, the uses are very oriented to the automobile. There's been less attention to the people whose lives are imperiled every time they try to cross a street or walk down it. Urban and suburban arterials account for the majority of pedestrian deaths in this country. So to address these concerns, we've been working closely with several of our district councils, our local chapters, on 8 demonstration corridors to think about questions such as, how can a focus on health and equity change the standard approach to urban and suburban arterials? What is a healthy corridor? How can a focus on health engage and inspire community action? How can low-income people and people that live in lower-income neighborhoods be better served by these roads? And what are the barriers to healthier corridors, and how can they be overcome? Each of our demonstration corridors has an interdisciplinary local group that is guiding the work, and that includes business owners, real estate developers, planners, community elected officials, community representatives, et cetera. We've been convening stakeholders and bringing in national experts to help each corridor address specific challenges and create actionable plans for change. And we've made recommendations in several areas, which are ways that we believe will create a more holistically healthy corridor, including improved infrastructure, design and land use patterns that support community needs, linking to other parts of the city, and engaged and supported people that live, work, and travel along the corridor. Right. In addition, there are several development projects across the country that I want to talk about quickly that are working to improve health and to provide more equitable access to housing and services. So ARIA Denver is an infill community that was designed with an intentional focus on the health of not only its residents, but the surrounding community. ARIA is being developed on a 17-acre site that was formerly home to a convent. The development has a very strong focus on healthy food access. It contains a 1.25-acre production garden, a greenhouse, and various other features to accommodate access to fresh produce. It is located on a major regional corridor, Federal Boulevard. It's neighbored by many low-income neighborhoods. So improving access to healthy food is really focused on not just enhancing conditions for the people who live in ARIA, but for the community overall. The developers have built 72 affordable rental apartments and townhouses, and have planned in total to have 450 homes. And it's looking at future commercial development, including a grocery store. The other food-focused features include an organic production garden with a full-time farmer, a pay-what-you-can farm stand that allows residents of ARIA and the surrounding community to purchase produce grown on the site at whatever cost they can afford, And there are also permaculture pocket gardens that allow residents to learn about permaculture, which is a system of sustainable gardening practices. So there are some educational components as well. A local nonprofit runs an on-site greenhouse that can produce up to 10,000 pounds of food annually. 75% of all of that is sold to local restaurants and a local university, while the other 25% is donated for affordable sale. The greenhouse is also run as a social enterprise and is tended by teenage youth employees. And over it all, there is a Cultivate Health partnership, which the developers of ARIA participate in, that provides healthcare services and nutrition education. The partnership also includes Regis University and surrounding neighborhood groups and is supported by the Colorado Health Foundation. The initiative does things like offer cooking classes and healthy eating courses for community residents and the local university students. There's an adjacent Regis Neighborhood Health Clinic, which offers primary care services, where providers will not only write more traditional prescriptions, but also offer prescriptions for fruits and vegetables. So this project really illustrates how innovative partnerships among real estate developers, nonprofit organizations, private philanthropy, higher education, and community institutions can produce a development with a set of shared priorities that are really focused on improving health and equity. And then Arbor House, located in Bronx, New York, is a 120,000 square foot building with 124 units of affordable housing. It's located in an area of the city with disproportionately high rates of chronic diseases such as diabetes and heart disease. The development includes a number of features to promote healthy living, including a hydroponic rooftop farm, which allows residents to buy healthy produce grown on the farm, including fruits and vegetables and herbs. 40% of the produce will be available to the surrounding neighborhood through school, hospital, and food market programs. And in addition to the healthy food grown on the roof, Arbor House includes features to promote physical activity, including indoor and outdoor fitness areas and playgrounds and prominently placed stairs. There's also a living green wall in the lobby, which this picture shows, that produces fresh oxygen, an air filtration system that helps clean the air. They use low and no VOC materials during construction. They maintain a 100% no smoking policy, which is designed to improve air quality in and around the development, as well as an integrated pest management program. So they're really trying to integrate a variety of strategies within this affordable housing development to promote the health of the residents. And then finally, Silver Moon Lodge is a mixed-use development with 154 studio and one-bedroom units of workforce housing that was built for renters seeking a car-optional lifestyle or renters that do not own a car in downtown Albuquerque. And the project is located adjacent to new bike lanes and designated cycling routes that provide easy access to the city's 400 miles of trails. So everything that the tenants need is within biking or walking distance. The location near trails and along the Central Avenue bike lanes allow residents to get to work or the grocery store or to go out to eat on foot or by bicycle, making owning a car unnecessary. The project is also conveniently located near a transit stop and has on-site car share service. So Silver Moon Lodge meets a demand for high-quality affordable housing in downtown Albuquerque. The building is consistently nearly fully leased. And then finally, I just want to touch on social equity at ULI. Social equity has not typically been a thing that real estate developers talk a lot very much, but we started a new effort this year to begin the conversation about social equity, focusing more on that first definition that I talked about earlier. So we've hired a consultant who is helping us reflect on how the organization thinks about equity and advise on opportunities to integrate social, economic, and health equity considerations into ULI's convenings and communications and content from a land use perspective in a way that our members will relate to. So we're looking to find solutions and identify best practices that can really assist our members and the larger real estate community with investing and developing in ways that promote equitable growth in cities. So we know that equitable growth provides greater access to economic opportunity. It's beneficial to a broad cross-section of the population, and it can help prevent or minimize commercial and residential displacement in communities. So this is very important to ULI as an organization and to our members moving forward. And we'll be releasing materials in the spring to help our members better understand social, economic, and health equity and provide them with strategies to help them address equity within their work. So in closing, I'll just say again that equity is not an easy topic to talk about, I think, especially from the perspective of real estate developers, but I'm really glad that we're having this conversation now. Thank you, and I look forward to continuing the conversation.